Hi guys, Dr. Amy Coleman with WellSmart Medical Services, and I'm here with Zilla. And we were just discussing some very important topics that I see come up with my functional medicine patients quite a bit. And that is that often when they're having complex problems, whether it be environmental exposures that haven't been tested anywhere else, or if it's some form of Lyme disease, or co-infections of Lyme, which around here, Babesia and Bartonella are very common, or if it's gut issues that are flying below the radar of your gastroenterologist, a lot of times functional medicine can help bring those to the surface so we can treat them and so our patients can feel better. And in the meantime, a lot of the work that we do here is actually just smoothing ruffled feathers from the experience that these patients have had and getting to this point where we could find the answers. And to be honest with you, it can be a feeling of being a little stifled or even censored or in some way just not heard or not understood. And part of that may be because the medical system's so much in a hurry, almost feels maybe in a cattle chute, some people will describe. And there's a lot of pressures on healthcare at this time and physicians to see more patients, and often they haven't been trained in certain areas that aren't problems that are going to kill the person, but are problems that don't allow the person to be their best self. When they're in that gray zone where the person looks okay, the labs are showing up normal, but the person's truly suffering, often academic medicine or just the typical medical clinic just doesn't know what to do with the patient if those labs turn back normal or it doesn't show something on X-ray, CT, or MRIs. They're done, they're finished. Is that kind of your experience too?
Yes, yeah, that's been my experience, and to the point where I saw so many doctors who assumed they heard that I was anxious or had a racing heart or was experiencing fear, that they would hear that and then not want to go any deeper. So it got to the point where I was, I don't want to say lying, but I felt like I had to be really careful with, I feel like I couldn't be totally honest with doctors about a lot of what I was experiencing because it would shut down their curiosity about what was happening with me. And even like you were saying about the cattle chute, I've had a bunch of primary care physicians in the last 4 or 5 years, and even the ones who I connected with person to person and I felt like I was receiving a lot of empathy from, they still didn't have the tools or the time to treat me. They just don't know what to do with me.
So you've had to go from doctor to doctor?
Yeah, and part of that is trying to find a doctor who will listen to me, and part of that is that the medical system is so taxed that even if I found someone who I liked, I would see them once and then my insurance would be like, oh, they're not in the system anymore, or the doctor would change practices, or both of those things happen to me. And then I have to start
all over again
with a new doctor who instead of just being like, this is what I'm experiencing, what can we do about it, then I also have to do this labor on top of it of trying to gauge how to communicate with this person. Like, how do I help them see how sick I am? But if I go in looking too sick, they might just think I'm depressed or dramatic or trying to get attention or and the number of times that I've felt miserable, like too sick to function, too sick to work, in bed for weeks at a time, and they call me and say, your labs look great, good news. And that's it.
That's it. That's the end. Once your labs are good, that's the end.
Yeah, then it's all over.
What's been different about your experience here?
Continuity. And then you and I have gotten to know each other through the acupuncture visits.
Absolutely.
Are a nice way to get to know each other outside of the normal clinical setting. The space is so much cozier. Your receptionist is fabulous.
Relaxing atmosphere.
And what I can't keep track of what we're doing to myself. I have this, it's funny, this whole corner of my kitchen is just supplements with post-it notes and how I'm supposed to take the supplements, and I don't remember what most of them do or why I'm taking them, but I feel better than I have I've been sick for 4 years at least, so I'm finally starting to feel like a person again.
And your labs were showing it that there's so many, and these
Oh,
labs
yeah,
are labs that are deeper than what you were tested before.
Because I was starting to think it was all in my head, right?
Yeah.
Everyone was just like, my dad thought that I was sick because I read too many articles about long COVID.
Oh no!
And it was reading the articles that was making me sick.
You came in originally for long COVID.
Yeah. So it's been nice to have like data
validation.
So there's like this like spiritual aspect, which is
like,
really nice. But I also really, even I think more so than that, being grounded in data. Right. It's really nice to be able to be like, look at this piece of paper, look at these numbers. Right. This is why I don't feel good. Yes. I told you I was sick.
Yeah, and she did the work. She did heavy metals tests, which were through the roof, and she's also done a GI stool effects test where we look deeper into the gut, and there was definitely some work to do there. And even giving her something for the gut actually helped secondarily
with everything else.
Help I think with a primary concern of issues in the throat, which was very connected, and that was one of her main issues. And it's been since September that we were together, so it's not like fast food medicine where you go in and I give you a pill and you're done. It's like we've been on like an investigative journey together where we're like just getting to the root slowly but surely, having discussions. What do you feel resonates with you as well? I'm not just throwing something at her.
Yeah, that's been nice too. Or I can just be like, I feel like this isn't working and I don't know why. And you'll be like, okay, we'll figure something else out.
When you have so many chronic issues that have been going on a while, your body can get super sensitive or can make too much histamine in the body. And this can make you just feel rotten all over in the way that if you were to take a lot of supplements with a lot of preservatives in them or fillers or things that would intensify that histamine reaction, you just wouldn't be able to do the program. It's no problem for me to go in and say she's got some of this chronic histamine activation, so why don't I make sure what she's taking is super clean and that her body's not going to react to. And I think that because we have the time and space to treat every person like an individual, that's where it makes a big difference for our patients. Plus, here, they're not afraid to mention some of these things. You might not mention to your doctor that you can't take fillers or preservatives in your capsules, and they would probably look at you like you have three heads sometimes. That's all we have here, sorry.
Or they think that I'm being like combative in my own care. They think that I'm
or not special or extra special.
Yeah, they think that I'm trying not to participate or that I don't want to get better. And
there may be some judgment.
Really want to get better.
You really always wanted to get better. But it's interesting too because I've done some training in classical Chinese medicine, not for the full 4 years, but I've really done some investigative research in it for myself because it resonates so much. And I wondered why classical Chinese medicine resonated with me. And it's literally because they took care of people for 4,000 years. And we are like a 200-some-year-old country thinking that we know the best medicine there is in the universe and through all time. And truly, if you do have a major trauma, then that is the truth. They can definitely do a lot with you in the ER and with surgery and whatnot.
We're thankful for all of this.
Yeah, we're thankful for that. But when it comes to chronic, underlying medical conditions that just keep you from being your peak performance self, there's just not the bandwidth for that type of investigation or interest in our current field of healthcare. It's just too saturated with the people that are much sicker. And so what I like about classical Chinese medicine is they focused on the individual. Like the classical Chinese medicine practitioner was responsible for keeping the community well, meaning if that community fell under illness or plague or if it had some issues, that medical practitioner would not be writing the books about classical Chinese medicine. They might have to report to the emperor and might be punished or not paid, or even worse. Their whole focus was know the individual, not the disease. Of course, you know the individual, and where there's disharmony, you can prevent the disease or even treat disease that's oncoming. And if you know the individual and you take into account, all the aspects that make someone well and focus on those, as well as regaining harmony where there's disharmony found, it's like that person can actually build their immune system, build their own reserves and resilience. It's almost like they're stronger than they were than if you were to just give them a pill for a symptom, right? So that's what I really enjoy, is just the ability to go deep within whatever somebody's sticking point is that prevents them from getting well, and taking away where some place in their body or some aspect of their exposure or some contract they have with their self or others. See, it can be mental, emotional, physical, where you have these impasses, but the body knows how to be well, and we just have to get out of its way. And I feel with Zilla, it's just been such a beautiful journey, because my patients are my textbooks. Every time they come in, I learn something from them, and it's just a joy.
Sorry, I'm not trying to interrupt you, but I feel like other experiences with doctors have been more in my way.
Yeah.
And adding to the trauma.
Yeah.
Or actually are the trauma almost more so than what I'm actually experiencing. Multiple times was like, I'm just going to stop going to the doctor. And then I got really sick.
Yeah.
And I needed some help.
Yeah. Is that when you came here, or was that, so you were at your sickest when you came to us?
Sort of. It's kind of, I'll get better and I'll get worse. And then I had been getting better, and then I moved to Kentucky and just had the big crash.
Yeah. So. There's challenges in living anywhere, and your body has to get used to where it's at and all the new challenges that come with it. But yeah, it's been a delight to me. Like I said, anytime I'm able to get to a deeper reason why somebody's not feeling better, I learn yet another reason why somebody can't get better. And that just goes into my toolkit and my understanding, and builds my compassion and the understanding of the mystery of our own well-being and how to unlock it. It's just, for me, just a passion. And with Zilla, it's such a pleasure because she's got a lot of knowledge of her body. She's got a lot of knowledge of herself. She knows what feels right to her body, what doesn't feel right, and she's very checked in with that. So it's quite a gift to have a patient that is able to have this inner knowing of what's right and wrong, and
a doctor to honor
and a doctor to honor that,
because I feel like bringing that experience to other people in medicine has just been like
headbutting.
Well, you don't know, your labs look fine, you're probably not that sensitive,
and doctors I don't know if they remember, but in medical school we learn about the nocebo effect, which is if somebody has a negative affiliation with what you're giving them, then there's more of a chance of it having an adverse effect on that patient because they believe it's not good for them. So the placebo effect is when someone gives you something, you're like, oh yeah, I need this, or I believe in this, and I know this is going to work. So the idea that the will of the person needs to be on board, and that there's no forcing or coercing or just taking their choice away, that's something I think also helps a person. We just had a discussion on some things about the thyroid and how she's not ready to start another supplement, so we just made some arrangements for something natural she can put in her food that's an actual herb that takes away any fear of supplements that in the past might have had a reaction because she's been so sensitive to them with her current condition. So working around things and making sure that we're getting what she needs, but in a different way. So it's out of the box thinking. It definitely takes time. Like our first visit was like 2 hours. But in that's normal and natural because I have to get the lay of the land, figure out the whole strategy, do the reconnaissance of everything that's happened to this point. But we have a lot of fun in getting to the answers so that it's not scary. If you do get an answer from a lab that doesn't look good, we teach you how it's going to empower you to know how to shift this to a different level by doing this or considering this. Knowledge here is power. It's not to be scared of. If we had not known this was happening, we wouldn't know how to start on a path towards resolving or actually bringing awareness is the best way of saying empowerment. Bringing awareness to something that's been in the dark, I always think is a blessing and not a curse. Even if it looks like bad news in the beginning, like when she found out she had SIBO or some issues with her gut.
I was so happy to find out SIBO, because you can do something about it.
She's like, finally,
like,
something
yes.
is showing why I'm not feeling good. I have patients that might say, oh no, I have SIBO, and then I have her that's like, I'm so happy that I have SIBO, I can do something now. So again, like knowledge is empowerment, and that's what functional medicine is about. But any last parting messages for patients that might be shut down and that might have gone through a lot with doctor to doctor and might be feeling as if they are just in a boat without oars in the middle of a lake? How would they get out of that feeling?
I genuinely recommend you to people all the time.
That's very kind.
I'm like,
thank you.
Yeah.
That's very kind of you.
And I feel like some of my friends are getting a lot of my friend group also has chronic illness, so I feel like they're getting a little trickle down medicine.
Yeah, true. That's true. Yeah, and I'm so glad you have those friends, because there are a lot of people that are on the journey of functional medicine that might feel isolated because they have such a regimen of their diet having to be so pure, and or different than what you would get if you were eating out with your friends or going home to eat with family. And they could feel isolated or alone in their journey. And a lot of our functional medicine patients, that's why I'm starting the group visits, is because everybody that's on this path of getting to their peak performance self at any age through functional medicine and longevity medicine that we teach people, what I find is we need community, because there may be friends that you can't keep up with anymore as you're on this path where you're having to eat well, sleep right, and do the right things. And yeah, the group visits are going to bring people together in ways that then we see that we're not alone. There's many people doing this type of work, and we can all revel in our own experiences together and know that, hey, this is a community of people wanting to be their best, and we can make new friends in that community. Yay. So I come to this very honestly. I was a very sick child for the very longest time, and they never figured out what was wrong with me. So I went to medical school, tried to figure that out for myself, and the answers didn't come from there, but it did come from functional medicine fellowship. It did come from classical Chinese medicine, Japanese acupuncture understandings, the way the body is more than just a piece of flesh luggage, much more arrangements of how systems work together and electrical nature of the body. And all of these has informed my ability to bring East meets West medicine together. And with that, it's just so rewarding to know where answers are for patients that eluded me when I was a family medicine doctor working in the ER. It is just a natural complement. It also brings a lot of compassion back to medicine, because there is an extended physical exam where there's hands-on and just checking people for how their body's doing at a very subtle level with classical Chinese medicine philosophies, using the meridian lines to help the body actually have a voice. If you feel like you need to have a voice, and if you want to have a good receiver of your own voice and a new way of being understood, just remember, like Zilla, our door is open. WellSmart Medical Services here in Lexington at wellsmartservice.com. Thank you. Thanks, Zilla.
Yeah, my pleasure. Thank you.